everybody. It's Monday, June the 12th, and this is the Dr. Simonds Metabolics and Weight Loss Ask Me Anything Facebook Live event. I'm Dr. Simonds, and this is Michelle Kennedy.
Good morning.
And as usual, we are open today, and we're doing the Ask Me Anything Facebook Live to answer questions about losing weight and obesity. That's what we're talking about today. As usual, we're going to give away a $25 Target gift card, which we will deliver digitally to the winner. Michelle, to win the gift card, what does one have to do?
So to be eligible for the gift card today, we want you to like this video and comment hashtag Simonds AMA. Susie is on it. And Susie is the prime example, right? That's what you need to do. Just write in the comment section, hashtag Simonds AMA and like this video. We're also going to be taking live comments and questions, but we have some really good ones, a whole page of long questions here that we're going to address. It has been 6 weeks, of course, since our last one. So we have the questions kind of piling up.
Weighty questions that came in over the last 6 weeks.
Yeah, so thank you for everyone who's watching us live. If you're watching this recorded, join us in 2 weeks.
That's right.
All right, if you can, at 10 a.m. on a Monday. Well, let's dive in.
Yeah, let's do it.
What's going on? So
Robin, we'll start with Robin. Robin says, what happens when you plateau on the medicine you're using for weight loss and you start gaining your weight back? This is a good question.
This is a really good question. A lot of people experience this.
Yeah,
this is not atypical, Robin. So the first thing is, it doesn't mean you're doing anything wrong. Right. So
your body is programmed.
Yes. Let's talk about why this happens, and then we'll talk about what to do about it. Right. So the why is exactly what Dr. Simon just said. Your body is actually defending the higher weight. So when you start losing weight and your weight is here, as you start losing and your body weight comes down, a defense system ramps up to try to push you back, right? Imagine like a rubber band being pulled. The resistance builds and builds and builds and builds. And that's why if you let go, it snaps back up, right? You get back to that higher weight.
It's not a character flaw.
Not at all. No, it's not that you're doing something wrong. It's not that you've changed something. It's really metabolic processes that kick in as early as 8 to 10 weeks into weight loss. And what is happening is the one hormone that makes you feel hungry, called ghrelin, right? Think of your stomach is growling. Ghrelin goes up as your body weight goes down.
Makes you more hungry.
Yeah, so you're more hungry than you were. And there's a bunch of hormones that help you feel full, and those go down. So you're more hungry, you're less full. And then what happens to metabolism?
That's right. The metabolism goes down.
Yeah.
You got it.
It's a protective mechanism, right? If you know anyone who accidentally lost weight and they were not ill, let us know, because we don't know anyone like that, right? It is purposeful when we lose. It can be accidental to gain because the body is happy to protect you with extra calories in case a famine comes.
That's right.
That's never good.
Yeah, not in this country.
Not in this country.
I mean, I suppose it could, but some sort of cataclysmic event. But in our lifetimes, in the last 100 years, this is not
hasn't happened yet. Yes.
In civilized Western society, it's overabundance. We do live in a very good time in world history.
Indeed.
But we inherited a genetic code and a physiology that protected us against those sort of things that weren't so pleasant that happened before that. And so that's the way our bodies are operating, according to that system, right? So look, one of the things I have said many times on this show before, that there are 4 pillars when you treat obesity. There's nutrition and physical activity and behavioral modification, and then medications or pharmacology, or however you want to say that, right? So you do have to pay attention to what you eat. You can't, this is not a time to be lax. This is a time to pay very close attention to detail and to really batten down the hatches on your intake, and to make sure that you're not allowing carbohydrates to slip in there, or excess calories in some form or the other that wasn't there before, that you're now slipping in there. This is a time to be physically active. Your metabolic rate has gone down, and And so, and if you've lost weight, this is the one time. Exercise doesn't really help you lose weight as much as it helps you prevent weight regain.
Yes.
So it makes a difference here.
Yes.
Okay. And then to be able to do those first two things, you have to change behaviors to do it, right? So I won't say too much about the behavioral modification at this point. But then the fourth point is medications. And you maybe need an adjustment in those. Maybe we need to add some more. And I keep harping on the idea of combination drug therapy, getting the doses right and using several medications from different classes at one time. Those may include things like phentermine, a classic appetite suppressant, things like topiramate, which we often use with phentermine, things like metformin, and then things like the newer injectables, what we call the GLP-1s. Those fall under common names like Ozempic and Wegovy and Mounjaro and semaglutide. These are things that can be used in combination for weight loss and long-term weight maintenance, and they're very, very effective when they're used in combination. And a lot of people have this idea that they just take one thing, and that if they take another thing, they have to quit taking the one thing. And no, they work together. It's like a fruit salad, right? A fruit salad, you can have several pieces of fruit in there, and it's not bad. It's good. Mm-hmm. Maybe that's not the best analogy when we talk about carb restriction, but you get the concept, I think.
Yeah. So these medications, they are prescribed by medical providers such as nurse practitioner like me, physician assistants, right? MDs, DOs. These are not supplements we're getting offline. These are pharmaceutical drugs that have been through clinical trials and proven to be effective. Now, what we do in our practice, which is progressive, even though it shouldn't be, is this combination therapy. We've been doing it in cardiac medicine forever, right? Not a lot of people, even if you take one pill, not a lot of people realize there's usually two medications in that one pill.
Yeah, that's right.
It's usually a diuretic with another blood pressure lowering medication. We do the same thing in medicine. It's just not many of them already come in combination. So we are using two of them.
Yeah, and if you think about it bigger than that whole scope of heart disease, people will be taking aspirin, they'll be taking lipid lowering agents, they'll be taking 2 or 3 different types of blood pressure medications. This is combination drug therapy that extends people's lives. In that scenario, we treat obesity the same way. Okay. And for those of you who have been here, yes, we have an on-site pharmacy. But I got to tell you, some of you may perceive this to be arrogant. I don't think it's arrogant. I just think it's a statement of the truth. Is that I think we're one of the only practices that does this. I just don't see a lot of people doing it. I see them talking about one medication, and then maybe they put you on some vitamins or something like that. But in terms of prescription medications that are specifically approved by the FDA to help you lose weight or designed to do that, I don't see many practitioners doing this. I'm alarmed by how many of them aren't doing it. And the information is there in the medical literature, and you and I have been trained how to do this and have been doing it for years, and it's very, very successful. But yet when I search for other practices that I can send people to, and say someone moves to a different place and they say, would you refer me to a place? And I start looking around for a place. I can't find anybody else that does it, right? And so it's like, wow, what is the hang up here with the medical community over this? So anyway, it's kind of discouraging in a lot of ways, but we're working on, there are organizations like the Obesity Medicine Association, for example, that are working on training more providers to do this sort of thing, right? More people out there doing it like us, so that patients will have a place that they can go and be afforded these services.
Yeah. So basically, Robin, give us a call. We would help you figure out, right, if the medicine that you're taking got you to a certain point, it did a wonderful job, but now it may be just working for weight maintenance or not working well enough to keep the weight off, and that's when we maybe add something else so we can get another layer of success under you. Thank you, Andy, for entering. And Charlie, I see Andy has a question. Former patient here, I did the keto diet off and on, but I suffer from kidney stones. Would a calorie deficit work better? You could try it. I mean, kidney stones are something that we can be genetically prone to. I believe the literature is not super strong that a ketogenic diet causes kidney stones. I think dehydration, electrolyte imbalances that we know can happen with a ketogenic diet are something we need to address and be on top of. But there are patients who do very well on calorie deficits, right? Generally, there is a carbohydrate deficit as part of the calorie deficit. We don't have a lot of people losing weight on a high carb but low calorie diet. But if you don't think keto specifically is for you, you could definitely try it and give us a call, and we are happy to help guide you either way.
Yeah, a calorie deficit does work.
Mm-hmm.
It's controlled starvation, I always say.
Yeah, it depends how hungry you are on it.
When you're starving, you don't die. You don't die.
But yeah,
Overweight.
could be worth a try,
Yes.
but make sure, you're drinking plenty of water. That is a key when it comes to those stones. They are no fun.
Yes, I think you make an important point, and that is that kidney stones are a rather common occurrence in society.
Mm-hmm.
And so you could go on any kind of, let's say you went on a Snickers bar diet,
you could
get kidney stones.
Yes.
And it could just be due to the fact that you would have gotten them anyway at that time. And it had nothing to do with the fact that you were on the Snickers bar stuff. The sun comes up in the morning. Did the sun cause your kidney stones? I mean, so it's hard to know these things. It is hard.
And a lot of us actually walk around without knowing that there are little stones in there, right?
That's
when
correct.
we say we have a kidney stone, that means it is starting to move and cause problems.
That's right.
But it's possible that we could have developed the stones two decades before, and that it's not actually presenting as a problem until later on.
The stones in the kidney cause you no pain.
Mm-hmm.
It's when they migrate into the ureter, which is the tube that connects the kidney to the bladder. That's when you get the problem. And Michelle is right. Those many people have those stones, don't even know, because the stones never break off and move down into the ureter, right? So they may have been there way before you ever did the keto diet. Yes. I do agree with your comment about the hydration and the electrolytes. I'm an ER doctor by training. I never worked a single shift where I didn't see a kidney stone. I saw them all the time, and every single last one of them was the urine was profoundly concentrated, which means they had not been drinking enough water.
Huge risk.
Yes, I never saw someone well hydrated have a kidney stone. Yeah. So,
that's a great point.
Yeah.
Thank you for that question, Andy, and thank you for everyone who's watching us live right now. If you haven't done so, enter for that Target gift card, comment #Simonds AMA, and like this video. All right, let's move on to Denise. Is it true that eating too low calories causes the body to stop burning fat and slow down weight loss, I assume?
Generally, I feel like that is not a problem.
Generally not.
Yes, I think that we eat too many calories, and there is plenty of data in the recent 15 years of scientific publication to suggest that fasting, for example, and really restricting your calorie intake is a very good thing. It does not appreciably slow your metabolic rate, and actually leads to many, many health benefits, including weight and fat loss.
Yeah.
Yes.
But we're going to circle back here. Remember, with our first question, we were talking about the fact that weight loss can slow metabolic rate. Mm-hmm. So I think this is sort of a correlation versus causation thing that people get caught up with. They lower their calories, they lose weight successfully to a certain point, and if they stop losing weight, they say, I must not be eating enough because my metabolism is lower. It's not because you're eating little that your metabolism is lower. It's because the eating little led to weight loss, and the weight loss is making it hard. Yes, for the lower metabolism.
That's right.
So Denise, in this case, what we would probably focus on is, where are your calories coming from? Mm-hmm. Are you getting enough protein, right? What is the quality? Because we do still want to make sure, even when our calories are low, our protein is high, because our metabolism is tied to physical activity, protein intake. Right?
Yes, that's right. And protein is only 4 calories a gram. We talk about getting 90 grams total a day. That's only 360 calories.
Yeah.
It's not a lot.
Yeah.
No. So you can get a lot of protein for a little number of calories, and
make a big difference.
That make a big difference.
Yeah.
Totally
protein
agree.
powders, protein shakes, right? That they may not need to be the mainstay of your plan, but they may need to be a part of it.
I will say that some of this idea, I think people got this out of the sports physiology literature, and they looked at the physiology of athletes and said, well, those people that were restricting their calories there had these lower metabolic rates. We treat patients with obesity. This is a different physiology.
Yeah.
Okay. And it doesn't behave like the athlete.
Yeah.
And that's an apples and oranges comparison.
Yeah. So with the protein grams in our practice, patients will know that come here, we like 30 to 40 grams per meal. So if you're eating 3 meals a day, we're looking at 90 grams. Most women going to be about 90. Some men are going to be more like 120 to 150.
Yeah.
But it is definitely not as hard as it sounds when you structure your eating in a more whole, unprocessed foods way, where you're eating animals, products that come from animals, and then plants.
That's right. Yeah. Our ancestors.
All right, Donna, thank you for explaining information easy to understand. You are welcome. That is what we were here for. This is what the AMA is, because we know you are getting, just like we are getting, very conflicting, very confusing information from social media and Google and commercials and what your friend said and what their friend said. So we're here to try to set it straight.
That's right. Yeah.
It's a lot. It's a lot. We totally get it. So thank you so much for that. All right.
Trevor says, I've read a lot about people saying it's healthy to lose only 1 to 2 pounds per week. My scales have been roughly going down 3 to 4 pounds per week. Is this bad? No, it is not bad. It is good.
Bravo,
It is
Trevor.
Decidedly good. And that's what we want.
Yeah.
I'm a fan of both ways, but I think that, remember we were in San Diego 10 years ago or something when Arnie Astroff presented his paper that they did with a bunch of European, 17 of them, I think, countries, had a big diet study together. They pooled their resources, and the people that lost the fastest actually kept it off the best.
Most successful.
Yes.
Yeah.
Yeah. So it totally blew out this idea. Oh, you got to lose slow.
Yeah.
No. The people who lost fast did the best in the long term. And so, anyway, if you're losing 3 to 4 pounds a week, that's awesome.
That's great. And if you are only losing 1 pound a week, that's awesome too.
It is.
And that's where we need to focus on the individualization. It is so much easier to put everyone in a box. Say you should take this medicine, do this diet, and lose this amount of weight. We are not like that. We are very unique beings, right? With different factors when it comes to our age, our gender, our metabolism. Have we lost weight before, right? What medications are we taking that may make it harder to lose weight? There's so many things that are going to impact it. So Trevor, if you are losing at that rate, it is not bad. Good for you. Keep up the good work. If it slows down and you're frustrated by that, give us a call. We can help you figure out what's going on. But that may also just be naturally part of that process where your body is adapting and defending. So initially it may be more rapid, and then it may stabilize a little bit at closer to that 1 to 2 pounds. And that's all right.
Bingo.
Very good question.
All right. Dana.
We got a long one from Dana. Okay. So every calorie intake calculator asks for activity level. So I'm assuming this is like a MyFitnessPal, the Apple Watch or something like that, right? Generally, options are something like this: either sedentary, which is like an office job, light exercise 1 to 2 times a week, moderate exercise, which is 3 to 5 times a week, heavy exercise 6 to 7 times a week, or you're an athlete, you're exercising twice a day. She's not sure which one she should select. She exercises 6 days a week at the gym. She does lifting, pushes herself hard. But after getting out of the gym, not moving much. Feels wrong to select heavy exercise, she's saying, because she goes to the gym 6 days a week, but then is kind of sedentary the rest of the time. What do we think about this? This is an excellent question. And we have seen at conferences multiple times where they do presentations on activity level, and they talk about how people who are not athletes, not even gym goers, but are in movement frequently throughout the day, have much better health outcomes and fitness levels than people who spend an hour killing it at the gym every morning at 6 a.m. and then they sit the whole rest of the day.
That's great.
So this is a great question because it brings to light the fact that just because you are doing gym time for 6 days a week for an hour, you are sitting the rest of the time, you are actually at a higher risk than someone who maybe has a job where they're moving all the time.
Yes.
As far as what to put in the activity tracker, I think while it's okay to say that you're doing either moderate or heavy exercise because you are having those days a week, one thing I want to be sure of is the whole reason that it's in the exercise tracker and the activity tracker is not so it can add calories for you to eat back because of your exercise. This is something we have a big struggle with some of our patients because they're confused with the activity tracker. We give them, a carbohydrate, a protein, maybe a calorie threshold. But then if they work out a lot, their app will say they can eat 500, 800 more calories. That's not the point of physical activity.
Yeah, I totally agree. I agree on both points. NEAT is non-exercise activity thermogenesis. That's the first point Michelle was making. It plays a much bigger role in weight loss than formal exercise does.
Yes.
Our ancestors did not join a YMCA. I always say they didn't. They were just physically active people during the day. They walked places and so forth, right? So in terms of your weight, that seems to do a really good job. And the sitting business is apparently a pretty bad thing for human beings, long periods of sitting and so forth. Now, look, I do think that, the hour-long exercise thing does help with strength and coordination, and it has benefits, right? Mm-hmm. But I wouldn't look to it to be your a primary modality to treat your weight. And so, just don't look at it that way. And that leads to the second point, which is, I wouldn't use those calories and say, I get all these extra calories. I have found that in a lot of people just doesn't add up, and they don't end up losing weight when they use those figures like that. And so over the years, that has not panned out in a lot of our patients.
Yeah. So having said that, honestly, if it is going to change the calorie goal in your activity tracker, if you put heavy exercise to where it's confusing, you don't want to eat more, but it's telling you can, put in sedentary then, right? Because you do have an office job, it sounds like. So most of the time you are sedentary, but just know that that doesn't mean what you're doing doesn't count. It just means you got to really more so focus on throughout the day at your job, getting up and moving, walk and refill your water bottle, walk and go to the bathroom, go down the stairs and back up if you didn't have a purpose, right? Just do movement at least every 30 to 60 minutes. Get up out of your chair and move.
Yes.
Great question.
Okay. Aubry says, I've been on a 1,500 calorie per day diet since October and have not broken it once. Wow.
Good for you.
Even at Christmas?
That's impressive, Aubry.
Even on New Year's Eve?
Right.
Okay. All right. You don't have to say that. We're not going to make you confess anything here. I'm down 64 pounds.
Wow.
And have about 21 to go. Wow. Congratulations.
That's
until
fantastic.
I reach my target weight. I have started to notice more hair falling out in the shower. I bet. Mm-hmm. I don't notice my hair thinning, just that more strands than I'd like to come out when I'm in the shower. So it's coming out. It's not overtly thin where she really notices it, but it's more than she used to have, and she notices it. So is this normal on a diet like mine? And I've seen some people online linking the diet and the shedding. Is this true in your experience? Well, yeah. If you lose 60, look,
absolutely.
on any diet, any diet that loses kind of weight, no matter what the diet is, this is a common thing.
Yeah, absolutely.
It's very common.
We do see this a lot, and I know there's a lot of different things on the internet, like, well, it's the specific way that you're eating, or it's this, specific thing that you're doing wrong. No, this is a very, very normal occurrence. What we are going to be focusing on is, is it bothersome? Like, do we need to change something? And it sounds like, yes, you're shedding more, but you're not noticing like patches or that your hair is getting really thin. If that was the case, we definitely want to intervene and change something. But we're just going to continue to focus on things like protein, right? For now, right? Making sure you get your protein. It'll correct
itself.
It will. It takes a little while.
It might take 8 to 12 weeks or something, but you'll find it'll correct itself. The cause of this is not exactly known. So, but it happens with every diet.
Yeah.
So you could be doing a commercial diet like Weight Watchers or Jenny Craig, or a diet like ours, or go get bariatric surgery. You'll see this phenomenon in all of those patients.
Across the board.
And so, like Michelle says, if you have balanced nutrition, in terms of the correct amount of protein and vitamins and so forth, that's about all you can do. And you just ride with it from there.
Yeah, and you can definitely add in like a skin, hair, nail vitamin. Biotin is very is a common vitamin for hair.
It may help. I've had patients say, this really works. I agree. And I've had patients say, no, it didn't
do
work.
anything. Yeah.
But then over time, it got better.
Yeah. This happens after pregnancies too. It's kind of just a normal phenomenon that like a few months after, you notice that a lot of hair comes
I'm
out.
55 and hadn't been losing any weight, just happening right up here on the top of me. Just saying.
I don't know if yours is going to come back, but with pregnancy and weight loss, it does.
Yeah. Okay. Yeah. I don't think mine's going to come back, to be honest with you.
It's a good question.
By the way, I will say, just because we went through the pandemic and stuff, and I've seen it, and I had to look it up. So one of the things that happens that is very common after infection with the family of coronaviruses is that 90 days after an infection, you can go through this hair loss. Yes, and it can last several months after it. So a lot of people, like when you're dieting over this long period of time, let's say you had, let's say maybe in January, for example, you got COVID and got over it, everything was okay. And then, April or something like that, you start losing hair and you relate it to your weight loss. It's actually COVID. Yeah. And so I've seen this happen with family members and patients, and it's a really common thing, and the hair loss can be pretty pronounced, and it can go on for a number of months. I've even seen it go on as long as 6 months. And so it's another one of those things to consider. It's kind of like the sun comes up in the morning, is it causing your hair
correlation,
loss?
Causation.
Right, yeah. So you think, well, I'm dieting, I'm losing weight, it must cause my hair loss. Well, there's other things that cause hair loss too, right? And so the other thing to consider is if you're a person who's been on thyroid medicine, say for hypothyroidism, and you lose weight, sometimes your levels get out of whack, and this can cause hair loss. And again, you think, well, it's just, I'll have people say, well, it is the diet medication or the weight loss, and in fact, maybe it's the thyroid or something.
Or something like anemia.
Yeah, right.
So you have to make sure too. If you have a history of anemia, you got to get your blood drawn.
There's kind of maybe other things to consider there. Yeah.
Sure.
But if it's just the weight loss that's doing it, it will correct itself.
Yeah.
And look, I just would say that if that is a true statement, and it sounds like it is, that's pretty impressive. 1,500 calories a day, haven't broken it since October. Wow. Congratulations.
It's very hard to
That's
do.
hardcore now.
Yeah. Give yourself lots of kudos.
Yeah. That's impressive.
That's awesome. So our last question is Chris asking, am I eating too little that it's unhealthy? My app keeps track of nutrients. I'm fairly low in some vitamins and in potassium, but I can't really add too many things and stay below my 1,500 calorie a day. It is possible to eat too little nutrition. However, when you're eating a lot of nutrient-dense foods, like animals, products that come from animals and plants, you are at a much lower risk for nutrient deficiencies versus if you're doing a lot of just like, pre-made, packaged, low-calorie things that don't have a lot of nutrient content. However, I do think a multivitamin can be a really good idea.
Yeah, sure. I agree with Michelle. And Chris, I don't want you to worry that you're eating too little. We don't. I've been practicing medicine for 25 years. I was in medical school and so forth before that. I've not seen any vitamin deficiencies in anybody yet in this country. No one's getting rickets. No one's getting scurvy. No, I mean, this isn't a problem in the United States. You're not going to get any of those things either. So I wouldn't worry too much about it.
Yeah.
If your calorie count is pretty low, fine. Just take. I agree with Michelle. Just take a multivitamin. Yeah, it's simple. It's easy to do. It works. There's lots of good brands out there. They're not expensive.
Yeah.
We got a real good one here if you need one that's made by Metagenics. I'm happy to hook you up with that. I think it's probably the best one, but that's all right. There's other over-the-counter ones that are great. And so anyway, don't worry too much about it.
Yeah, thanks for your question. And everyone who entered, we have a winner today.
Yes, we do.
It is Sandy.
Sandy is the winner.
A little cutie pie is a picture. Hello.
Winner, keto dinner.
All right, we will be in contact with you, Sandy, for your gift card. Thank you for everyone who attended live and for commenting and the questions. Submit for next time. 2 weeks we'll be back.
That's it.
Well,
we think.
Right now we'll be back
That's
in 2
right.
weeks. I know it's been 6 weeks since our last one.
I know.
We'll plan to see you in 2 weeks.
Sometimes we get derailed with other things, but we're planning on being back in 2 weeks. So everybody enjoy the next 2 weeks of summer, and we'll see you in 2 weeks.